So right now, let's welcome Tim Bishop.
Thank you. Thank you very much. And let me start by saying thank you to Lori for once again opening up Smithtown Senior Center for us. We've done many programs here over the years, and she's always been a wonderful host, and I thank her for that, and I thank her staff. Also, I'm delighted that my friend Smithtown Supervisor Pat Vecchio is here. He is right over here, and he's a very good friend, and we've worked together quite well and cooperatively over the last several years. And you all know this, but he's the longest serving supervisor in the history of the state of New York. So that's something to be very proud of. So what we're going to do today, we have exactly an hour. We have Ronnie Hauser here. She is the Congressional Liaison for National Government Services, and she's going to talk to us about the issues of Medicare fraud and abuse and identity theft, and how to protect yourself against these problems, which unfortunately are more and more prevalent. This is the second of 3 of these that we're doing. We did one this morning at the Riverhead Senior Center, and then our third one this afternoon is in Mount Sinai. So we're going to have to stop at 1:30, pardon me, to make sure we get out to Mount Sinai in time for that. So Ronnie will make a presentation to you, and then we're just going to throw it open for questions, both about anything that she says, and then any issue you want to raise with me, either on Medicare or Medicaid or Social Security, or any issue that you want to raise, we'll be happy to talk about it. So with that, let me introduce to you Ronnie Hauser.
Good afternoon, everybody. My name is Ronnie Hauser, and I work for National Government Services. National Government Services is the contractor who processes your Medicare claims for both Part A and Part B in New York and Connecticut. We also handle fraud allegations and complaints. The Department of Health and Human Services, Office of the Inspector General, estimates that millions of dollars spent on Medicare and Medicaid is lost to fraud and abuse. 10 cents out of every dollar that is spent on Medicare is lost to fraud and abuse. This program, or this problem, affects all Americans. It affects beneficiaries by wasting Medicare money that could be used to increase and improve health care services and premiums. It affects caregivers by decreasing funding available for programs, and it affects everyone who pays taxes by wasting billions of taxpayer dollars. National Government Services works with New York State Office for the Aging to support the important activities of Senior Medicare Patrol, that's SMP. Senior Medicare Patrol is a partnership between the federal government and state agencies to fight fraud and abuse in Medicare and Medicaid. SMP also acts as a messenger between beneficiaries or caregivers and the appropriate organizations who can address suspected fraud, errors, or abuse. Senior Medicare Patrol programs empower seniors through outreach and education to increased awareness and understanding health care programs. Committing Medicare and Medicaid fraud is a crime. Seniors, or Senior Medicare Patrol, encourages beneficiaries like you to report suspected cases of health care fraud and abuse. SMP works with state and local agencies to maximize our resources in the fight. By identifying and reporting fraud, you will play a key role in improving our country's health care system, as well as guaranteeing that the Medicare program will be around for many years. National Government Services also supports the Senior Medicare Patrol Hotline. It's a way for you to call in, leave a message of a possible fraud case for us to investigate. I say possible because If an issue seems fraudulent, it may not necessarily be so. Sometimes when you receive services in a hospital, your doctor's office, you may receive a statement, and on the statement you have two charges. One can be from the hospital itself for using the facility, and the other could be for the doctor that actually took the test. This may seem as though it's fraudulent because it's double billing, or it seems like double billing, but it's not. It is permissible. Or your Medicare summary notice may indicate a surgical procedure, which you know you didn't receive. However, the surgical procedure indicated may actually have been for an injection, which you did receive, or debridement of tissue, which could have been done by a podiatrist, removing calluses or dried skin. Many providers have offices separate from the ones that patients normally visit that handles medical billing. The doctor's address might be different than what you're used to. If the services seem correct, if the place doesn't, and you did see the doctor that's indicated, that is usually not a fraud issue. If you do suspect fraud or have questions or concerns, your first point of contact should be the doctor. Or you can call 1-800-MEDICARE. If you still feel that there's a possible fraud situation, you can call the Medicare hotline. The number is 877-678-4697, and it's on the back of the pamphlets that we handed out. We will review each complaint and handle it on an individual basis. The resolution is based on the issue and the results of the investigation. It is important to note, however, that the complainant may not get any specifics on the outcome, a satisfactory answer, or a resolution quickly. The case may become involved in a much larger issue that is an ongoing case, and it may take years to resolve. So don't get discouraged if you don't hear from us with a resolution for a while. We also are not permitted to discuss or share information on any ongoing cases. The federal government is committed to preventing fraud and abuse in the healthcare system. A joint initiative was created in 2009 between the Department of Justice and the Department of Health and Human Services to focus their efforts on deterrent of fraud and also to enforce anti-fraud laws around the country. With the help of HEAT, that's H-E-A-T, and it stands for Healthcare Fraud Prevention and Enforcement Action Team, the government recovered nearly $4.1 billion in fiscal 2011. Also, the Affordable Care Act will provide an additional $350 million over the next 10 years to help ramp up anti-fraud efforts. Now, what can we do in our daily lives to aid in this effort to detect and stop fraud? It is most important that you check your Medicare summary notices. Keep a record of doctor visits and compare it with the Medicare summary notice. Are the dates correct? Did you receive the billed services? Did you see the doctor indicated on the Medicare summary notice? There are so many scams and schemes targeting seniors today. We encourage you to consider the following tips. Guard your Medicare and Social Security number. Never give any personal information, like your Medicare or Social Security number, to a stranger or let anyone borrow it. And I just want to show you something. Does anybody have a Medicare card with them that I could use? You do? Somebody have one? I have one. You do?
Here we go.
You don't really know me. I am a stranger.
I never get my Social Security number.
I keep telling my husband, don't give information out over the phone.
Don't be too easy to show it, and secondly, you don't need to be carrying around your Social Security card or your Medicare card. The only reason that you should be having it is if you're going to a doctor, or you're going to a hospital, or you're going to a pharmacy. It's just not necessary, and if you can keep it home in a safe place, I think you're better off. So please keep that in mind. It's not necessary to carry a Medicare card around with you unless you are visiting a doctor, a hospital, or a trip to the pharmacy. Never accept medical supplies or equipment from a door-to-door salesperson in exchange for your Medicare number. Never accept freebies, groceries, scooters, or other gifts from anyone wanting your personal information. Don't give personal information to anyone who calls you out of the blue. This includes your Medicare number, your bank account information, or credit card number. Even if he or she tells you that he's a Medicare representative,
Don't believe.
correct. I would suggest hang up the phone. Medicare does not call beneficiaries or make house calls requesting personal information or cash payments. Seniors can help fight fraud. Keep a personal record of all doctor visits and other health care-related services or ordered equipment in a journal or calendar. I brought a great tool with me to help do just this. It's a folder, it's pretty sturdy, it can hold, I would think, most of your bills, it can hold your Medicare summary notices. It's got a great little recording on the front where you can list the date of the service, where it was performed, and if you want to make any special notes about this. And if you all promise to clap for me when I'm finished, I think I have one for all of you. Each Medicare summary notice should be checked for accuracy as soon as you get them and compare it to bills received. Ask yourself, were you charged for medical services or equipment you didn't receive? Do the dates of service and charges look unfamiliar? Were you billed for the same service twice? Does your credit report or unpaid bills for Medicare services or equipment that you didn't receive? Don't be afraid to pick up the phone and report any mistakes or suspected fraud. We thank you very much for your help in detecting fraud, and we want you to know that we appreciate all the calls that are made advising us of possible fraudulent practices. In closing, I thought I'd share a few fraud cases that I thought were particularly interesting. Mr. Brown received a phone call from an individual claiming to be representing Medicare. He told Mr. Brown that his Medicare card would no longer be accepted and he'll be sending him a new card. The new card would cost $299. When Mr. Brown refused the offer, the caller said his Medicare and Social Security number would be terminated. But Mr. Brown was smart. He was able to capture the caller's number on his caller ID and forwarded the information to the SMP Senior Medicare Patrol hotline. As part of these scams, callers are asking for bank information or telling beneficiaries they can provide new Medicare cards for a fee. They are stating that they need bank information from you so that they can electronically withdraw funds. Please note again, it is against Medicare rules to call a person with Medicare and ask for bank account information or any other personal information. A gentleman reported that his wife called a supply store just to get some general information about a scooter. The next thing they knew, the scooter was delivered to their home. The scooter was much too big for their home and couldn't be used. Despite numerous calls to the store, they would not take the scooter back and charged Medicare for it. Enough information was gathered by the supply store during the phone inquiry to process the order for the scooter. And lastly, most of us take those summonses for jury duty seriously, but enough people skip out on their civic duty that a new ominous kind of fraud has surfaced. The caller claimed to be a jury duty coordinator. The gentleman protested that he'd never received a summons for jury duty. The scammer asked for his Social Security number and date of birth, just so he could verify it and cancel the arrest warrant.
Oh.
This scammer used intimidation over the phone to bully people into giving out personal information. My final message to you today is to please remember the 3 B's. Be careful, Be cautious and beware of anyone who is asking for your personal information.
That's right.
Are there any questions? Yes.
Yeah, you had said that it's about $4 billion Medicare fraud a year. Did I hear that?
Well, they've recovered.
They're recovered, yeah.
Yes.
So you know how people turn in people that they think are stealing money from the government, like things. What about, why not offer a bounty to Medicare users for any money that they recoup? In other words, let's say you turn somebody in and they save $100,000. Why not offer a person a percentage of that, the way they do in other ways already? For instance, you have internet fraud and whatnot. You turn people in, and they pay a bounty to those people. Why not do the same thing for us? In other words, give an incentive for somebody to say, hey, I didn't incur this charge. So this way, let's say even if it was 1%, it'd be like saying, okay, here's $1,000 for saving us $100,000.
It's very interesting. I've honestly not heard that before. I think it's
the government already does this in other ways, in other areas.
Yeah, I think that would have to come from a really high level to...
I think it's a great idea. I think it would have to be legislated. I think Congress would have to act. We do have it. I believe we have that system for some of our contracting agencies. For example, if we find defense contractor fraud,
Right, exactly.
I think that system exists. So we have the template, and I think it's a great idea, and I will pursue it. Thank you.